Thank you for joining us this morning. I'm going to go ahead and kick it into gear really quickly. We have Kylie Clendenin and Meg Fruth from MOBO Medical Spa, which is a traveling spa out of Lancaster. I think Meg is going to go first because she has other things going on this morning as well. So Meg, I'll turn it over to you.
Yeah. So I'm Meg Fruth. I'm a nurse practitioner, and I'm also one of the co-founders of MOBO, which is a mobile med spa concept that we developed back in 2017. My business partner is Dr. Lorianne Scott, and then we actually have had Kylie with us for several years now, and she's wonderful. She's probably one of the people that you will talk to on the phones if you ever call us, or that will answer some questions for you and help you get an appointment. And so she's been our right-hand person as we've grown. We founded MOBO to start bringing med spa services to areas where there might be demand, but not a close by med spa. We wanted to bring high quality med spa services where people were already going for beauty or for body services. And we currently have now not just our flagship operation, but we have 4 franchisees, soon to be 5. We have 2 medical directors. Lorianne is the executive medical director, and we have 1 other physician with us, 5 nurse practitioners, a licensed esthetician, an RN, and then multiple support staff within the organization. So our mission is to make med spa services kind of more accessible and more safe to be consumed in areas maybe not at the cosmetic surgeon's office, right? But we're still a full-fledged medical practice. Each of our operations are a full-fledged medical practice in their own right, and we follow all of the precautions and all of the standards we would as if we were in a medical office. So patient privacy, all those things kind of travel with us. Our core menu of services are one of the biggest things that I do is Botox and filler. So Botox is we're going to get into that in a little more detail, but Botox is a wrinkle relaxer, and there's a couple different brands that are used. We do dermal fillers, body sculpting. We offer lipotropic injections, medical weight loss. I do have the ability to prescribe. So, we offer skincare, but it's prescription grade skincare. So we are able to make some amazing changes in the skin, and Kylie actually helps us in a big way with that. We have body sculpting technology that we bring with us in some locations. We offer microneedling, dermaplane facials, TCA chemical peels, and then one of the biggest things in the industry right now are basically mini facelifts, so cheek and chin augmentation to kind of give you back a jawline or to lift the face. I'm going to talk about injectables, and then I'm going to hand it to Kylie to kind of talk about our other services. So wrinkle relaxers have been around since their FDA, since Botox was approved for cosmetic use in 2002. So all of them are botulinum toxin A. So they are a medicine that's used to specifically relax the muscles that cause the lines of expression. So we use Botox in the forehead, in the 11s, the crow's feet, and in the 11s, and then in the crow's feet. So when you smile, you don't get those crow's feet. When you scowl, you don't make the 11s. We know a lot more about Botox than we did when it first came out. So when it first came out, it kind of got a bad rap. I think it was overused, was used all over the face. Now we use it in a much more natural way. So it's really for the everyday person now that just wants to combat the signs of aging or age a little less gracefully and combat father time a little bit. We can use it in the upper face. I do use it as an advanced injector in some parts of the lower face as well, in select patients. So we can do a little Botox lip flip or treat a downturn smile. And then in some cases for people that have teeth grinding or TMJ, we can treat the masseter muscles here. The results of Botox last about 3 to 6 months. And as you keep up with it, you tend to go a little longer between treatments. Most people start out about 3 months between treatments, and it takes 2 to 10 days to take effect. So after you walk out of my office, you're not going to have the Botox like totally in effect. it's going to be a few mornings from then that you're going to totally, start noticing the difference in your muscle movements. And then in turn, by relaxing those muscles and the skin cells are turning over in an environment where they're not folding all the time, we see those lines of expression soften. So you can go to the next slide, Kylie. This is just kind of an example of how we use Botox to achieve an aesthetic benefit in the upper face. So you can see the 11s softened and the lines across the forehead softened significantly in both of these patients. Dermal fillers are a lot of fun. So fillers are used, we use a hyaluronic acid-based gel to add back volume that you've either lost through the aging process or never had to begin with. So when we do filler, we can use it in, treating the nasolabial folds, the lines between the nose and the mouth. We can treat the cheeks and actually place it on the zygomatic bone and like lift the cheeks. And, if you're looking in the mirror and constantly saying, oh, what if I just, pressed back here, then that is an indication for cheek filler. I do a lot of lips. I do a very natural looking lip. I'm not looking to make people look like a Kardashian. I'm just trying to help their lips look like what they used to look like before they aged. And in my younger patients, I do add fullness to the lips. So that is something that we are seeing a lot of younger patients now coming in wanting fuller lips, and we are able to do that, but in a natural, non-ducky way. So that's my big message there is I'm going to go slow. I'm never going to make you look weird. It's always, my aim is always to make it look natural. We do fill the marionette lines, those lines between the corners of the mouth and the chin. And like I said earlier, we are doing a lot more cheek and chin augmentation. So that's, a newer indication for dermal fillers. That filler tends to last about 2 years. Other fillers in the more dynamic areas of the face can last 9 months to 14 months on average. It's safe. It's a hyaluronic acid based gel that we have a reversal agent for. So there is some downtime. There's always the risk of bruising, always the risk of being a little swollen or a little lumpy bumpy right at first. Over time, though, that filler tends to just kind of become part of your natural anatomy. And I always like to tell people, like, after 4 weeks, let's say you woke up from a coma and didn't know you had filler, you shouldn't be able to tell you had filler. You're not going to be aware of it in your face. Go ahead and go to the next slide, Kylie. So this is a good example of chin augmentation and jawline contouring. And I think there was a little in the lips there too, but big difference for this patient that had just a constantly, we call it a constipated chin, but like just a constant, weak mentalis. And then by offering that support, contouring the jawline, it ended up giving a really nice aesthetic benefit and more of an outward projection. Go ahead and the next line, the next. So, and then this patient, this was just a tiny bit of lip filler. And then this is a good example of use of Botox in the lower face. So again, not something we do frequently, but some people, might have a gummy show to their smile or might need to show more of their lip, and we can use Botox that way, plus a little filler to create a nice aesthetic benefit. Go ahead and go to the next slide. This is just a good example of a younger person wanting fuller lips. So certainly, her lips weren't aging by any means, but she just wanted a fuller lip that's in high demand these days. And we have a lot of fun with lip filler with our younger patients. Okay, next. And then this is a good example of full face correction over time. So I've worked with this patient for many years. And over the course of those years, we've lifted the cheeks, we've filled the marionette lines, done the lips, jawline, nothing unnatural, but certainly took at least a decade off of her face. All right. And then let's see here. So I'm going to actually turn it over to Kylie. Kylie's going to talk about our body sculpting. Body sculpting is a medical procedure, and some of the things Kylie might talk about are physician only or nurse practitioner only. So she won't be able to answer any questions related to specific medical procedures. I will say that if you have any questions about what we might recommend for you or pricing or anything like that, feel free to book a free consult. I go several places in Fairfield County. I am actually all over Ohio, but we go several places in Fairfield County. So I always encourage you to book a free consult. talking is free. And I love educating patients on these services and on what the recommendation might be that we can work slowly over time. So I have, over 1,000 patients, and they're all repeat customers that we kind of have a nice relationship over time that we can achieve some pretty amazing things. So again, Kylie's going to talk about some of these services, some of which are medical only. So again, the medical questions she can't answer specifically, but we can certainly book a one-on-one private consultation with you. So Kylie, want to take that over?
Awesome. Can you guys hear me?
Yep, you're good.
Okay, cool. Just making sure. Okay, so body sculpting, the machine that we use specifically is called TrueSculpt ID. And it is one of the newest treatments that you can use. It's non-invasive. It is indicated for circumference reduction, and it uses radio frequency and heat to do that. A lot of people do the abdomen, their love handles. You can treat your chin and neck. You can do your underneath your arms, your thighs, and we see a lot of good results from this machine. The clinical trials showed 24% of fat cell elimination. And what's different about this one is that it has skin tightening as well as fat reduction because of the heat, which is pretty sweet. There is no downtime, so you could come in for a service and then go right back to work. It may feel like you have a little bit of a sunburn, but usually people are totally fine. Full results you see in 8 to 12 weeks. So when you walk out of the appointment, you're not automatically going to have that reduction. It takes a while for your body to get rid of it. But usually you will see those results in 8 to 12 weeks. And then you can do, based on where you get it done, 1 to 3 treatments for desired results. Usually more for the chin, so more on that 3.3 treatment mark. And then for the other ones, usually 1 to 2, but sometimes 3 as well. So here's a good before and after of what the machine can do on the abdomen. We offer lipotropic B12 injections that have B12 obviously for energy, but also other vitamins and amino acids that facilitate weight loss, muscle recovery, and improved energy. Usually we do these monthly, and it helps support patients that are doing physician dispensed medications and supplements to support healthy and sustainable weight loss. Each person is customized, each patient we have, and Meg and our other providers will be able to give you a customized plan based on what you want and your budget. Skin pin microneedling, this one's really cool. It's the skin pin is the one that we use, the device that we use, and it's cleared by the FDA. Clinically shown safe and effective to treat acne scars, and actually they just did it for the FDA clearance for neck tightening for people that are 22 and up. It's cleared for fine lines and used to treat wrinkles, large pores, the neck and other body areas. Some people use it on stretch marks on their stomach or legs. It's really cool. The typical regimen usually includes 3 treatments. They're spaced 30 days apart, so you come in 3 times 30 days apart and combine the treatment, usually with a series of peels. But what it does actually is that it creates micro injury, so it kind of tricks the skin into thinking that it's hurt, and that stimulates the body's natural wound healing process. It sends up all the good stuff like collagen and elastin, and it minimizes cell damage. And the result of that would be remodeling scar tissue, especially from acne scars, and improving collagen, but overall keeping the structure of your skin intact. So here's a before and after. You can tell the pores on the left are larger. So we're just really working on evening out the skin's texture. Chemical peels, we have one that's only physician assisted, that's done by physicians actually. It's called the VI peel, and it's really, really amazing. And then I personally do a couple of other ones. It's the best way to restore youthful skin and chemically exfoliate your skin. Our medical grade peels treat a variety of skin concerns, so melasma or hyperpigmentation, acne scarring, fine lines, or if your skin is just kind of lackluster or dull. After getting a chemical peel, you can notice having brighter or tighter dewy skin right away. And visible peeling begins over the next 3 to 6 days, and all of that damage will come off. Comprehensive skincare regimen is provided post peel. On the VI peel, you actually get an app and you sign into that, and it'll tell you like, it's in the morning you need to do this, this, and this. In the afternoon you need to put this on, and then in the evening do this, and then it'll also track your progress, which is pretty sweet. But there are different options for the chemical peels, what you could do, and with your areas of concern and what you want your desired outcome to be. So on this one, you can see the pigmentation and also the scarring is definitely less on the right side. But they also, I've seen some really good results with hyperpigmentation, and the VI peel actually just like pulling it out of the skin, which is really, really amazing. And then this is my #1 service that I do personally. The other providers do it as well, but this is, since I'm an esthetician, I do the majority of these. It physically, dermaplaning exfoliates the top layers of skin and removes peach fuzz. It reveals brighter, smoother skin right away. And it's often combined with a light stimulator peel. I do these in Dr. Scott's office during the week, and I'm there all day on Mondays, and then I schedule appointments throughout the week. I'm also in school for nursing right now, so I'm just trying to build up my business, and yeah. So this is my favorite service to do. It really does make a big difference in your skin, and you will feel way better right afterwards. And I also do a lot of prescription skincare. A lot of this stuff is only through a doctor's office, so I do have to go over everything with Dr. Scott or Meg or another one of our providers. But I do work a lot with the different products and making sure like what you want, making sure you get what you want. So I can treat sunspots or melasma, acne scarring, fine lines and wrinkles, neck laxity. So if your skin is just feeling kind of and then vitamin A, C, and E are critical components to our regimens, as well as medications such as hydroquinone. That's one of the biggest ones that we use. And then SPF is crucial to protecting the skin from photo damage. That is the #1 thing that I use. We have a couple of different really great ones, and yeah, so that's all of the products that we have. And if you ever wanted to come in and talk to me about products that we use, I would love to talk to you about them. And that's my whole presentation. If you want to learn more or have a free consultation, you can go to mobomedspa.com, and there is a button at the top of the screen where you say request appointment, and you can pick a location, or if you don't know where, Meg also does phone consultations, and I do phone consultations, which make it pretty easy if you don't want to go into a place. So yeah, that is everything. I'm going to stop sharing my screen, hopefully. Awesome. Okay, so that is everything for me. If anyone has any questions for me.
Kylie, this is generally where we cue the awkward silence, so don't be alarmed.
Okay.
I'll ask a question while other people are waiting or thinking about what theirs is. I saw that you guys can go to different events, or like, what's an event that you typically go to and what do some of those services look like?
So we go to different salons. So in town, we go to New You Salon, we go to Julia's, and we kind of just pick up someone does an one-on-one appointment with us, and we can do any of those services that I listed at any time, basically. So and then she also does private parties. So if you just want, she has a mobile bus, and you can just take it to your house and show up, and all of our stuff's in the bus, and it's really fun. So if you ever wanted to have a party.